I'll, well, I'll just say hello to everybody. If anybody's on, Nicole, Allie, and I can't really see, but we're going to wait a few minutes for more people to join because we have a lot of people who signed up. But just welcome everybody for the webinar to discuss Alexandra Shaker's new book. We're so
Thank you for being
excited.
here. I'm so excited to be here.
I like that you're holding it up. Welcome, everyone.
Yes. Yeah.
So we're going to give it just a few minutes and start around 1:04 as people file in. And we have you here from London, Dr. Shaker.
That's right.
Yes.
That's right. I'm really happy to join you all. This is the magic of technology, I suppose.
Yeah.
It's the evening, huh?
It is, but we are having a kind of a sunny week so far. So it feels earlier in the day. There's actually like unseasonably nice weather.
Nice.
So I feel like I'm maybe closer to the time zone you all are in, thanks to the sunshine.
Oh, it's so nice.
Yeah.
Well, it's a nice sunny day in New York too, so that's lovely. And I imagine we're
Oh,
going to have
good.
from all over the place.
Yeah.
Can we enable captions? And we have some people already in the chat. Lovely. Kit, were we able to enable captions? Do you know?
Unfortunately, I don't think we are able to today. That is something that we will look into for the future. Thank you for pointing that out. I will double check settings right now, though, to make sure that to just double check and see if that is possible. If not, it will be on our YouTube next week, and YouTube will have the captions so we can rewatch it that way.
Okay, great. Well, why don't we get started? And I'm thrilled to be moderating this today. So we're talking about Beneath the Surface, a conversation about maternal anxiety and the body. So thank you for joining us today for what will surely be a very powerful conversation in honor of Maternal Mental Health Month this month of May. I'm Dr. Nicole Vanderwick. I'm the Chief Clinical Services Officer and Director of Training here at the Motherhood Center, and I'm thrilled to be moderating this conversation. We have Dr. Catherine Birndorf, a reproductive psychiatrist and the CEO of the Motherhood Center of New York, and Dr. Alexandra Shaker, clinical psychologist and author of The Narrowing, A Journey Through the Anxiety in the Body, for a timely and intimate dialogue about the intersection of anxiety, the body, and the maternal experience. So together they're going to explore how anxiety is felt, held, and processed in the body, especially during pregnancy, postpartum, and early parenthood. Drawing from Dr. Shaker's deeply personal and research-informed work and Dr. Birndorf's clinical expertise in treating perinatal mood and anxiety disorders, this conversation will unpack the often invisible physical toll of maternal anxiety and illuminate pathways to healing and resilience. So whether you're a healthcare provider, a new parent, or a mental health advocate, we're glad to have you join us and invite you to ask some questions rather, and we can get you some answers during the discussion through the Q&A button there at the bottom rather than the chat button. So before we get started, I want to just share a little bit about both of these guests. Dr. Alexandra Shaker is a licensed clinical psychologist with a background across inpatient and outpatient treatment settings. She writes, her writing is an interdisciplinary exploration of the human condition. She integrates psychology, literature, history, anthropology, and language to speak to the meaning and vitality we find in the stories we tell one another and ourselves. Dr. Shaker received her PhD in clinical psychology from the New School for Social Research and conducted her doctoral research at the Brief Psychotherapy Research Program at Mount Sinai, Beth Israel. She completed her clinical training at Columbia University Medical Center, and she also completed a postdoctoral fellowship in perinatal mental health at the Motherhood Center of New York, where she holds a position. She held a position as a clinical psychologist and is now a clinical consultant. So welcome, Dr. Shaker. And
Thank
then
you.
we have Catherine Birndorf, a psychiatrist. She's a reproductive psychiatrist who is also the CEO, co-founder, and medical director of the Motherhood Center of New York. Dr. Birndorf is the founding director of the Payne Whitney's Women's Program at Weill Cornell Medicine, New York Presbyterian Hospital, where she is a clinical associate professor of psychiatry. She's a graduate of Smith College. Dr. Birndorf also attended Brown University Medical School and did her psychiatry residency at New York Presbyterian. For 10 years, Dr. Birndorf was a regular mental health columnist for Self magazine and appeared on numerous television programs, including The Today Show, Good Morning America, MSNBC, and CNN. Her most recent book, What No One Tells You, A Guide to Your Emotions from Pregnancy to Motherhood, was published by Simon & Schuster in 2019. So welcome, Dr. Birndorf.
Thank you.
I want to start first by, since we're coming to you from the Motherhood Center, if you would share, Dr. Birndorf, a little bit more about what the Motherhood Center is.
Sure. So the Motherhood Center is essentially a treatment facility, a clinical facility where we are able to help women and birthing people and families and now partners and dads who are struggling with what we call PMADs, perinatal mood and anxiety disorders. And we're going to talk a little bit more about what that is. But our mission is to educate, to diagnose, and to treat these disorders that are so common. And we'll learn more about it. But at the Motherhood Center, just so you know, we have kind of 3 levels of service. We start with support groups and education, and we have a robust outpatient department where we can do all different kinds of therapies, as well as medication management. We run groups and we have individual treatment and family sessions. And then we have a day program, which is our most intensive level of care. And that is where we treat women who are struggling more intensively with moderate to severe PMADs. And they come in every day, and we have a nursery on site, and they are cared for here where I'm sitting in the center today in an office. And it's just it's a wonderful place to be. And you can check it out on the website. If you haven't seen it, you can see a few pictures and get a sense of what we do every day. So glad to be speaking to you guys.
Amazing. All right. So I guess I wanted to start a little bit in hearing Dr. Shaker, your book, telling us a little bit about it's called The Narrowing. It conjures up such a physical constricting sensation, just that title itself. Can you share what inspired you to write the book?
Yes, absolutely. So the narrowing was inspired from a few different points of view and some of my own experiences. I had been wanting very much to write kind of in the clinical sphere throughout my training, and had been sort of having a lot of different ideas percolating over the years. And ultimately kind of came to a point in my life where I felt that I was ready to put them down. And I wanted to explore anxiety from a number of perspectives. I have always been interested in a kind of interdisciplinary look at mental health. That's kind of always been how I came into the field and how I've liked to think about things. And so in the narrowing, I wanted to integrate scientific research, research that would feel fresh and as close to the cutting edge as possible, with aspects of history and drawing from the arts, in order to think in a really deep and nuanced way about anxiety, which, as we know, is both a part of everyday life and an aspect of mental health that sometimes requires treatment. And so when I thought about the title for the book, I really wanted to evoke the visceral experience of anxiety. And in my research, I have this amazing dictionary called the Dictionary of Untranslatables, and it includes all sorts of fascinating word definitions. And when it comes to anxiety, I was really taken by sort of the etymology of the word and this idea of narrowing as it pertains to both this kind of cognitive experience and this physical experience of narrowing. So that can mean narrowing of our focus and attention when we're anxious. It could also be something like the constriction of blood vessels when we're anxious. So there were these different layers of meaning to the word, and it really kind of it really felt evocative to me in a way that I think reflected my own experiences of being anxious, and I think those experiences of others as well. And so it stuck.
It's so interesting, and I think your book, when I read it, I thought it was so comprehensive. There are so many layers to this, and the lenses with which you look through and examine anxiety. And part of that was also sharing your own experiences and your own story. As clinicians, there are different theoretical orientations around this of whether you disclose or you don't disclose. And I'm curious for both of you, what your experience is with that, and sort of what when do you decide to disclose more about yourself in your clinical work, and why?
Sure. Well, so for me, I think I see differences in how I would approach disclosure clinically and in a writing context. And so I have not been one to disclose too much of my own experiences in a clinical setting, where I think my focus is really always been at the work, kind of in the room that isn't about me. But in my book, I wanted to be really honest, because I felt that knowing that I would be drawing from experiences and from a topic that has such personal meaning to me, it would come through to readers. It would feel disingenuous if I wasn't willing to be reflective about my own experiences of anxiety. And so I put a great deal of thought into determining how to disclose in my book in ways that would feel useful. And I think ultimately, and I talk about this a little bit in the opening, if we think about our role as a helping role and one in which we want to be of service, I wanted to do so maximally in my book, and I felt that by being willing to share some of my own experiences, I could be hopefully a source of greater kind of personal wisdom in a context where it felt appropriate to me.
Yeah, I would add on to that. I mean, Allie, when I read the book, I was so impressed with the care with which you spoke about your own experience as you introduced the book and the ideas about anxiety. I was like, just from the title, which is evocative, which is such a great word, to just how you described it and what your own personal experience was like. And I did think it was very courageous of you, because those of us on this screen are all trained similarly, at least with some psychodynamic background, which is not to disclose much, right? Is to stay pretty much a blank slate, which the idea of which is not to be punitive or absent, but to allow for the maximal experience for the patient to really be in the room and use you or us as kind of a window into themselves or a mirror to themselves. So I think that the idea is that once you bring yourself into the room, are you, what happens then? And so I think it's been a question for a long time. How much do we step into the space? So I will just share, I think that the older I've gotten and the more I've done this, I don't know that it's the more I share, but the more comfortable I am in certainly sharing certain things. But my training was pretty like, don't say a word, just be curious. But it didn't feel right to me either, right? And particularly, I think when you do work around motherhood, there are a lot of questions for us. And whether you answer them or not, what people ask, the questions people ask are often so much of what's on their mind. What they want to know about us is what's on their mind. So there is stuff to talk about between us, but I do also tend to answer some very basic questions, because I think it can be very helpful. And to your point, Allie, useful in the treatment. If not gratuitously, right? But just if it's useful and it makes sense, and then to understand that.
Well, and it comes across as a very lived experience, which has a
Yeah.
lot of vulnerability in it, and your own exploration of anxiety, I think through these lenses also sort of speaks to the challenges one feels in having anxiety or having a PMAD or a mood disorder, and sort of thinking about um, the amount of like shame and questioning and how challenged we feel in the world reflecting on these things. So I thought it was interesting to explore it from that point of view, one in which there was so much vulnerability and authenticity about what is going on in my body, what is happening for me. I wonder if you could share a little bit more about that.
Yeah, I mean, I think for anyone in the webinar who's a clinician, or for anyone who's just sort of experientially wondering about this topic, you know, when we think of lots of mental health experiences, but certainly anxiety, the visceral elements of it are often the first ones that come to our attention, the first ones that bring people into treatment. And so I think understanding our physical experiences as one and the same as our mental experiences is something that's ultimately incredibly impactful and useful. And I think, you know, thinking a little bit about the conversation we were having just a few minutes ago about theoretical orientation and training, you know, I think it's tricky because traditionally, certainly in my training, you know, taking into consideration our physical bodies was not central to the work we were doing as psychologists. And so I think in some ways it was really a matter of privileging the thoughts and experiences that were expressed through behavior or through language. And over time, I've come to really feel like that dichotomy is a very false one. And so, in order to really treat people and also for the purposes of understanding our own well being, we need to be seeing our body and mind not as two sort of like conversing systems, but as one system that we can glean different kinds of information from across time. If that makes sense.
So really looking at it through a somatic lens as well.
Yeah.
Right?
Yeah.
And I wonder, Dr. Birndorf, in your clinical experience, how does maternal anxiety show up physically? And how do you help patients make sense of what their body is trying to tell them?
Well, as is being said, it's a anxiety is a very physical experience. And I think sometimes I think of it as kind of the manifestation. It's a signal, it's an external or bodily signal of what may be happening inside. And I don't mean to be distinguishing, to your point, Allie. I really like that. I think that they're one and the same. We reduce it to these separate parts so that we can have an easier time talking about it, but really I think it is so much more integrated than we understand. And so I do think, though, for women who are, you know, trying to get pregnant and postpartum, there's a lot of anxiety around that time of life, that transition to becoming a mother, or matrescence, as it is also called. And often the first signs of it are your physical anxiety. And that may come with a racing heart, or, you know, sitting in a waiting room, feeling kind of sweaty palms, or kind of, you know, not being able to catch your breath, kind of shortness of breath, or what people might describe, you know, colloquially as like, I'm having a panic attack, right? Which really is also what a panic attack is, right? All sorts of a list of physical symptoms that happen kind of abruptly and doesn't go on forever, but will decrescendo after a few minutes, but super intensely physical. I mean, you can't have anxiety it is not just mental. It is also a bodily experience, and the commonality of it is kind of apprehension and a feeling of dread, right? That is typical in there. And I think that no matter how much you want a baby or are looking forward to it, it is a both and situation. You can't escape the unknown. And Allie, you talked about this a lot in the book, the idea of uncertainty. Like, there is nothing less certain than the idea that we're gestating a human inside our bodies, and then they're going to be born some miraculous way, because how does that happen? And then they're going to be a person outside of us. So I think that just screams anxiety and ambivalence and all kinds of things. So, I mean, we see it all the time. And I'll just to cut to like super treatable, but we're not there yet. So we won't have to talk about that. But I just want to say that all of the stuff that comes up in the body and in the mind and in one's experience of becoming a mother, thankfully, much of it is treatable, although that sounds really crazy. You can't treat motherhood, so to speak, but you can certainly treat the signs and symptoms of anxiety that are attached to an extent. So very practical and Darwinian about allowing there to be an amount of anxiety so that we can keep a totally dependent human being that's alive.
Yeah, I think that brings up this question of like anxiety and how it narrows focus and attention. And is that helpful? And how is it helpful? And how does it also create challenges? When do you know, oh, I need help? Like this is too much. Because there's also something incredibly adaptive and necessary having anxiety.
Yeah. I mean, this was really, really important to me in my book, was thinking about anxiety as we all know it to be this wide spectrum of experience, much of which is part of our everyday lives. It's part of being alive. And, as we all know, it's very necessary. It has a purpose. It is for, the purposes of our own well-being. And then certainly in the context of pregnancy and parenthood, in the context of keeping another human being alive, as Catherine is saying, very important and necessary. And I think the same is true of this narrowing of focus and attention when it comes to anxiety, that, to a point, it's really useful. We need some of that. We need to do that to thrive in parenthood. We need to do that to thrive at work. We need to be able to sort of narrow our minds in order to complete a task. These are all really useful things. And so I think we don't want to pathologize anxiety completely. At the same time, there comes a point when things go too far, when you feel as though you are actually having kind of a diminished capacity to engage in your life, to engage at work, to engage with a child at home, if you have a young baby, or if you're pregnant and you're sort of finding yourself really struggling to take any sense of joy in the experience, feeling like your attention is constantly sort of directed toward potential negative outcomes. For me, these are all thresholds. These are all points where clinical intervention makes a lot of sense.
I guess I wonder on that in terms of different interventions, Dr. Birndorf, what does the Motherhood Center have to offer in terms of moms who are suffering from anxiety? And do you distinguish that from, you said PMADs? Can you say more about that?
Yeah. So PMADs, which is really not, as I always say, my favorite acronym, because it has the word mad in it. And we're talking about women's illnesses, although they do affect men as well. It used to be the old like postpartum depression, right? Like, so when I started in this field in the late 90s, I don't even know, I guess we sort of said postpartum depression, but mostly were like, oh, whispered. Did you have that thing in the postpartum? And then it became sort of postpartum depression, but then people weren't finding themselves either postpartum because they were they were pregnant. So they were like, well, it can't be me. Or they would be anxious and not depressed. So it got way too, speaking of narrow, way too narrow. So it really wasn't helpful. We needed to open that up. And so kind of under the umbrella of perinatal, which is during and after pregnancy, right? So prenatal or antenatal and postpartum after pregnancy, that's the perinatal period. Mood, which is like depression, bipolar disorder, different kinds of mood disorders, and the anxiety disorders, which include generalized anxiety disorder, panic disorder, phobias. It used to include OCD and other disorders, but several of those got kicked out, which is just fine. They sort of are defined in a different area now, but that's all included, as is psychosis and postpartum psychosis and PTSD. We tried to include PMADs. Really is everything we can cram under that umbrella that could happen to somebody. And it's defined really by the time in life. So it's really anything during that time, any mental disorder in that time of life, in the perinatal period. But it has come to be called PMADs. perinatal mood and anxiety disorders. And we hope that everybody who's struggling in any way or suffering during this time can find themselves or will recognize something about themselves so that they can come to treatment if they are having a hard time. So what we do at the Motherhood Center is we spend a lot of time educating about this. And in a way, that's what this seminar is about, this webinar is about, because it's the idea to get the word out there. And we have to educate all the time, because it's really hard to believe that people don't recognize that you can actually struggle when you're pregnant, or that when you're postpartum, it's not just bliss, and that you're not just so happy to have a kid that everything else is secondary to that. So that's what we used to believe, right? Like, and many, many people still believe that the motherhood myth is alive and well. And to some extent, we are trying to dispel that, and say that it is also beautiful and wonderful and a challenge. So when it is a challenge and that challenge crosses the line, which we can talk about too, and you're into real distress with the symptoms that you have and a level of impairment in your everyday life, whether it's in your personal realm, your professional realm, or whatever realm it's in, then we know that we're talking about something beyond what's considered adaptive or quote normal, right? Then you cross the line into illness. And that's what we do at the Motherhood Center. So we have multiple treatment modalities or options that are talk therapies and different kinds of support groups, as well as medication when needed, to really treat these disorders that come up during this time of life, not uncommonly.
Yeah, that makes me think a little bit about Dr. Shaker, what you talked about in your book. You talked about safety and danger and what
Yeah.
comes up around that. And I think for a lot of new moms, thinking about a lot of worries about keeping their baby safe, right? And sort of when does it turn into something that becomes that's gone awry? And I wonder if you could speak more about that, the safety and
Yeah.
danger.
Absolutely. I mean, I think when I conceptualize anxiety, I always have these concepts of safety and danger at the front of my mind. Sort of no matter what the anxiety is about, I think ultimately it speaks to feelings of unsafety, feelings of being, at risk of danger potentially in our lives, sometimes in ways that are rational, sometimes in ways that aren't. And I think parenthood, and certainly pregnancy as well, bring about this sort of incredibly pronounced experience of facing risk, facing potential for danger, facing sort of potential for one's own bodily danger, the well-being of a human little baby that you're responsible for suddenly. These kinds of moments, I think, are just absolutely inevitable and part of the perinatal process. As well for partners. And I think they kind of ask us to look at our perceptions of what is dangerous, what is safe, what is a risk, what is not a risk, in ways that we may not have previously had to face. And I think this is one of the reasons that the perinatal period can bring about anxiety that could, for some people be a fairly new experience. Whereas for people who are, who've experienced anxiety prior, it can exacerbate existing symptoms. So I think one of the things that we need to be doing is trying, whether it's for ourselves or in treatment, trying to understand our own perceptions of feeling unsafe, feeling in danger, and what is really behind them, what's going on sort of beneath the surface, understanding the fear behind the fear sometimes. And then I think on the other hand, we need to be really understanding about the real dangers that that people can face in the context of childbirth, in the context of being in medical settings and so forth. We need to be having honest conversations about these realities, rather than sort of suggesting that they are entirely unfounded. So I think there's a real balance there, and it requires a lot of curiosity and a lot of conversation between couples, within families, and with treatment providers and patients, sort of across the board.
Yeah, you used a term that I hadn't heard before, but sort of this cyberchondria, sort of,
Oh
and
yeah.
a lot of this at the Motherhood Center and with a lot of people that I work with. But we're all going down these rabbit holes, on Google and researching things. And I wonder about when you use cyberchondria. Could you say more about that, about what happens there?
Yeah, I mean, research on cyberchondria is sort of interesting because I think it sort of it reflects just the way that we live today. So we know the term hypochondria. We know about this phenomenon of sort of struggling around feeling that one's body is well, or having a lot of concern about potential illness in the future. These kinds of things. And now in a period of history when we can kind of access lots of information alone without necessarily inquiring with really anyone else, but a lot of that information is not great. There are kind of new versions of anxiety that are coming up and that are starting to be studied more and more. So I think what's interesting about cyberchondria in some ways, this idea of kind of going to Google, or I guess maybe now it's like, I'm not great on the AI stuff, but the land of AI, like going down these rabbit holes alone, trying to get answers to questions about your health, is that generally you end up feeling more afraid, more alone. You don't get answers that are generally very reassuring. And I think most of us know in the back of our minds that this is not a great way to answer medical questions anyway. So it is sort of a form of reassurance seeking often. It's a way of trying to quell a fear, but it is generally not successful. And I think it leaves people generally with just a sense of feeling even more concerned than they were initially. I remember when I was at the Motherhood Center, we would talk about Google-induced anxiety disorder, another kind of GAD. And I think that has really just sort of like unfortunately blossomed into a larger problem because the amount of information that is sort of potentially at one's fingertips has grown, but the capacity that we generally have to interpret it has not.
Yeah, and I think about how painful it is, to want to know, to be uncertain, to look for information to guide us, and we have less of a community often as you go into parenting. There's so much siloed off now, and we are looking for ways to know what to do as new parents, and it can be incredibly painful to not know. And the discovery of parenthood, right? The learning of parenthood happens between parent and baby, mother and baby, and trying to be attuned. And we do a lot of dyadic work at the Motherhood Center, and thinking about like how a mother, how a parent can discover the baby, and the baby is also discovering the parent. There's a back and forth. And I'm curious about, Dr. Shaker, you shared in the book how your own parents suggested that wrestling with anxiety would be a fixture of parenting. In our work
Yes.
here, we often reflect about when a parent becomes, when you become a parent, you have to have discovery and be creative, and there's a lot of trial and error. And I wonder about the postpartum brain and having anxiety and how it impacts learning. And if you could share a little bit more about that.
Yeah, absolutely. So yeah, in one part of the book, I reflected a little bit on my own uncertainties when I was pregnant with my son, and sort of going to my own parents for their kind of their wisdom, and they were essentially like, "Welcome to parenting. There are going to be a million things you just don't know," and sort of coming to terms with that over the years. And I think um, with new parenthood, there's this kind of strange message that we're going to have this maternal instinct. We're just going to know things. We're going to know how to do things. And I think that's generally not a reflection of most people's experience. And so I think there is, I love how you put it, Nicole, like this kind of mutual process of learning one another between a baby and a parent that takes time, and it is not always automatic. And it's something that I think we do forever. I think we do it with children and with other adults in our lives. It's not something that just happens at the beginning. And I think learning to sort of see the beauty in that, and to see that the trial and error has its own kind of power in it, and that we can sort of demonstrate, like, maybe I didn't get that right, but I can try again and we can get it together. That's actually the most powerful, I think, thing that we can kind of model and learn in clinical settings and with our children. So I think, you know, if I try to summarize my sort of stance on this, I think we want to sort of bring into the conversation with parents this idea that this is normal. This is going to happen. There's going to be so much uncertainty, and that there is this, I think, larger sense of safety and kind of togetherness in saying maybe we don't know, but we will figure it out. I think that's really the message that I think is most ultimately most powerful.
Yeah, it makes me think about Dr. Birndorf. I've heard you say often that the Motherhood Center, every mother should be able to go to a place like the Motherhood Center, and the Motherhood Center mothers the mothers. And I wonder
Mhm.
if you could share a little bit more about sort of how do we begin to normalize the need for care for mothers and parents, and reduce some of the stigma around needing help and not knowing how to do this.
Yeah. Well, I think you were saying it, Nicole, and then Allie picked up on this like idea of attunement, and like how it makes me, and probably makes all of us think, like, how were we mothered? Like, was anyone paying attention to us? Were they watching did they see us? Were they responsive to our needs? How were they responsive? And I can certainly tell you, being older than both of you, that back then we were very much seen and not heard. I don't think anybody knew to pay attention to us babies, right? We were far more, in some ways, object than subject. And I think we have really flipped in this current day and age to the baby being very much the center of attention. And very, it doesn't mean we're all getting it right, by the way, nor do I know that that was bad and this is good. I think it's, I don't know that there's a right way. But I think that the idea that there's mutuality, that like that babies have experiences and that they're people from the get-go is so important, to begin to figure out sort of what's happening. And you know, it's really hard, I think, for a lot of our patients. They come into the Motherhood Center with their new babies, and they feel so bereft. First of all, they feel so unwell. So the idea that they would take care of a dependent creature just seems unbelievably difficult. And then, you know, they're not well. And so once people, you know, are able to sort of stabilize and get well for themselves through multiple therapies and, again, maybe medication, they're more able to attend to the baby and begin to say, who are you and what is this relationship? And again, it's never too late. I don't care if it starts way late in life. It's never too late. That's in some ways we offer potentially a reparative and corrective experience along the way. And I think, Allie, you were sort of saying it, we are always in relation to our kids or our parents forever. And it's always changing. So, and I think it's a work in progress till the end. So it's the process of it. And at the Motherhood Center, it's just one phase of that process where there's a lot of learning that goes on because there has been illness. And I always say it could be for anyone. It's kind of like mother school, because I wish it didn't have to be just for people where we have a diagnosable illness like depression or anxiety that we can get insurance to pay for. I wish it were for everybody, because most of us weren't parented so intentionally the way that we now know so much more about. So a lot of the moms here end up looking back at their own experiences of being parented and think like, wow, what was that like? Because you often have to reconcile that, not before you become a mother, but in your process of becoming a mother, because, you know, we repeat until we understand. So if we don't know what happened to us or why we do what we do, we tend to visit that on the next generation, right? We tend to do that again, because you think, or you either do it or you react to it and do the opposite, right? You're like, I'm going to not do that. So it's really subtle. I'm going on too long here about too many things, but you know, it's a complicated process. But I do think first, patients or people who are not well who come in need to be cared for or mothered, so to speak, and then they can then learn to mother. themselves as they consider what that means and how they were mothered.
Mhm. Yes, it's definitely intergenerational, and and the identity, right? Such a shift in identity of who am I? I am now a mother, or I'm now a parent, or a birthing parent, and what that means, and it can emerge, right? As time goes on, and this dance between you and baby, starts to develop. I want to get back to something because there was also a question in the Q&A around the stigma, and we have learned from history and culture about the anxious impulse, and you talk a lot about this, Dr. Shaker, in your book, especially with mothers. And what is it that has shaped the stigma that they still face today historically? What is it about anxiety in mothers or women?
Mm. I mean, I think unfortunately, much of the stigma is reflective of the misogyny that we know has been present for throughout human history, frankly, and which we know is still very much present today, and which impacts healthcare around the world, and I think is in no way resolved. And so when I think about maternal mental health care, maternal health care in general, I think part of what we face is the reality that women's health is so often under-researched. It's not random that we don't have more of it available across the country. This is the sad reality. And so I think it's sort of a social justice issue in many ways, trying to really think carefully about what we perceive about women's mental health and how we talk about it and where it comes from. It's not new and it's not gone. That is sort of how I think about it. I think in terms of fighting that stigma, I am happy to see. I mean, okay, there's obviously a lot of problems right now in terms of research funding, so we know this. But if I sort of speak about public conversation about women's health, I think it's really heartening to see more of it happening. Certainly in the case of maternal mental health, I always find it interesting what's published around Mother's Day in the media. And it does feel to me like every year there is more being written and being read and talked about the maternal experience in ways that feel more honest, and more reflective of reality than the year before. So that's, it's one small example. But I think ultimately what we need is more research, more funding, more attention for women's health. And that is ultimately what's going to be most impactful.
Yes.
Yeah, I would add that there has been a real shift. I mean, because there has been over the years, at least since I began in the field, 25, 30 years ago, so much more research and funding. I mean, until recently, perhaps, but that we were headed in the right direction. And the stigma, which I guess was the original question. I mean, I do think you're exactly right, Allie. Like it's not a gender issue. It's everybody. I mean, the same way that maternal mental health is a family issue, and childcare, and healthcare, and maternal health. I mean, these are family issues, but they have not been taken up in the same way by men as they have so much by women. And I think until it's across the board, it's going to be hard to really, make it an everybody issue. But the truth is, everybody knows somebody who's been affected. So to say, that it doesn't affect you is just, might be because you don't know what you're looking for. But the stigma is still strong. And so you're right, Allie. I mean, it does get better every year. There's a little by little, even though there have been some backward. I mean, it's not a straight, upward trajectory. We go backwards, with the Dobbs decision. Like there are decisions along the way where you start to feel like women are really just second-class citizens, that we really don't have, the same rights or the same opportunities. And it's just kind of a fact. So the idea that there would be a stigma related to that there's a field called maternal mental health already is a subspecialty of medical, medical or mental health, which, I mean, I'm glad it exists because there's so much to know, but in another way, it really shows how on the margin the experience is. So it's not going away anytime soon, but I think women and moms and families are much more, there are more numbers of people talking and sharing and writing books and telling truths and sharing experiences that allow it to be just more in the common space than it ever was.
Yeah, it makes me think about, this sense of, this messaging of we can have it all as
Mm.
women or birthing people. And this idea of like how challenging that actually is when put into practice. And I think about mothers need help because babies need help. They're utterly dependent on you. And that doesn't get talked about enough. Instead, I think what gets messaged is, um, women are hysterical or maternal gatekeepers, or why can't they handle it all? And I think that also goes along with the stigma. If you start to feel anxious or depressed or ruminating and having some of these, I think, real treatable illnesses, it can make you afraid to go in for help because it sort of speaks to, I'm not able to handle it all. What's wrong with me? Rather than normalizing that, like, it takes a village. We do need help. And of course, you need help because babies need help. They're utterly dependent on us. Um, and I wonder if there's anything else you would add to that. It makes me think about like anxiety in particular and how it is a natural part of the human condition, and how we start to build resilience around that. Can you speak to resilience and kind of what that means in terms of anxiety?
One quick thing I just want to say, but then I would love to hear what Allie has to say on the question, is the system isn't set up for us to do it all, right? There is no, affordable childcare or paid leave is not, the things that would allow women to do it better, to do it all, like with the system. I think we can name all kinds of things, but when people see themselves and there's illness and we blame, ourselves for what's wrong, I think we also have to just look at the landscape and the system at large. But back to resilience, because that's what it requires.
I mean, it's the perfect link, really, because I think, in my book, I spend the last chapter focusing on resilience. And, the research on resilience is very clear that the way toward resilience is structural, not individual.
Yeah.
We can all develop resilience individually in a variety of ways, which is obviously powerful and worth doing and worth practicing. But the powerful kinds of resilience that are available to us are social. They are built by communities. They are enforced by governments that provide resources. These are the ways that we create resilient systems and resilient people. I think the thing about resilience is it can often feel as though it's presented as a trait that we do or don't have.
Yeah.
And that is just not the case. We can develop resilience, certainly in the context of parenthood. I think there are certain kinds of strategies we can use to build resilience in this new context with new stressors. But ultimately, to see real change socially for families, for parents, for all people across age groups, these are social questions. And I think we can look across different countries to think about what kinds of social services exist. This is, certainly for parents and babies. This is for the elderly. This is for everybody. And these are just not things we are meant to do alone. These are social structures, and they require the support of larger kind of communities and so forth to make them real.
Yeah, that makes me think of, there was a quote in the book, the nervous system has to be convinced it's not alone. And it makes me
Yes.
think about when you talk about communities and co-regulation and this idea of, somebody asked in the questions, how do we normalize these conversations, especially with families whose cultures are not of Western society? And it makes me think of like, what does the nervous system, what do we need as humans?
Well, yeah, I mean, I love that quote. That's from Stephen Porges, who developed the polyvagal theory. And he has this really impressive way of linking physiology and our emotional lives in ways that feel really poignant. And I think this idea that the nervous system has to be convinced it's not alone, we can kind of see that on a number of levels. There's a physical reality to that, that's part of what he's talking about, but there's also so many layers of interpersonal reality to that. You know, that's something that happens between a baby and a parent. That's something that happens to us in partnerships in adulthood. That's something that I think a social structure can convey to the people living within it. That, you know, on some level you are not alone, and that that changes what life feels like. And so, you know, that to me is really like every tier of functioning would benefit from this sense of not being alone in the world.
Mhm. What does the Motherhood Center provide in that aspect, Dr. Birndorf, of thinking about like you're not alone in this?
Well, I think it's a community at its best, really. I think when women come in for treatment, they join a cohort of others, and you can see yourself coming and going. And maybe it's not exactly the same, but there's this universality of we are all becoming or have become or are mothers. And what does that mean? And to share the experience is to make one feel less lonely or alone. So I think that just having a safe space to talk about this, and it doesn't have to happen here at the Motherhood Center. It can happen in other ways with a friend or a confidant or a relative or a therapist or whomever, that you share your internal experience so that you do not feel alone with it. And I think that mitigates has the potential to mitigate anxiety, and also certainly to mitigate loneliness, which is an epidemic um, currently and probably always, because I think life is very much about finding closeness between, you know, being born alone and dying alone, right? There's sort of this experience of how do you navigate being in relation to others during this brief time on Earth. You know, Al, you ask a lot of beautiful, hard existential questions in the book, too, things that you have thought about a lot yourself. Those are things I think about, too, and I know Nicole does as well, all of which can lead to anxiety because many of them are unanswerable. But I think even the process of talking about them and having space to think about it and utter it out loud, and you see other people that you're in treatment with, or even, like I said, if it's a one-on-one situation where you can feel like those are valid questions and real concerns that may or may not have answers, but the process of talking about it and trying to understand it and what the meaning that you've given to it or want to understand from it can be processed, makes us all feel less alone.
I mean, absolutely. When I think of the time that I was working at the Motherhood Center, you know, I think that seeing the experiences that people would have in the groups of being able to sort of reckon with these unanswerable uncertainties, you know, these really challenging aspects of entering into motherhood, for instance, that don't have fixes, but doing so with other people was incredibly powerful. And it wasn't really about the answers, you know, it was about not being alone with those questions. And I think kind of going back just a couple of minutes, you know, thinking about families where kind of a more intergenerational approach to raising children is more common. I think, you know, you can really see the power of that when you don't experience it. In some ways, you can kind of see how the experience of having other people in your life who can kind of show you, you know, maybe this is how you might do something, and also most powerfully, you are not by yourself. You know, and I think in the nursery at the Motherhood Center, one of the things that was so amazing to witness was this sense of kind of not necessarily through instruction, but just through modeling and presence, seeing this kind of intergenerational passing on of knowledge and wisdom. And I think that's such a part of parenthood that, at least in Western society, is often just not present. You know, our households aren't always, we don't, you know, this intergenerational household is less common. And, you know, many people are sort of from day one home from the hospital alone for the rest of their maternity leave. And that's really typical, and really sort of like not the way that I think anyone thrives. So I think we can learn a lot from sort of thinking about how else, not necessarily reinventing the wheel, but how else this has been done and can be done And I think the Motherhood Center has a way of kind of providing this experience of being together with other people with babies or other people with experience, so that you can sort of like be together in this uncertainty instead of sort of falling into this very lonely place, which we know is so, unfortunately, so common.
Yeah, and you're also in this moment in a parenting journey of, sharing your life, beginning to share your life with a new human, a new baby, right? And thinking about figuring that out together. I often see some of the moments in the nursery with new parents is this idea of like, I don't know what I'm doing yet, but we're going to figure it out. We're going to figure it out and kind of play with that idea of tolerating. We talk about distress tolerance, but playing with that idea of kind of tolerating the not knowing. And that is also inherently where resilience is built. And I just think this has been such a phenomenal conversation. And I thought your book was so, again, very comprehensive, very personal, such a beautiful voice in there, Dr. Shaker. Um,
Thank you.
I want to thank both of you. And I don't know if there's any sort of final thoughts on this, but I do think, as somebody said in the question and answer, that, like we need more of these conversations. So I think it's a great book. And I think the Motherhood Center is doing such impactful work for communities of parents.
Thank you so
Yeah.
much for having me. It was so meaningful to me to talk with both of you. It means a great deal to me, and thank you all for joining in.
Thank you for your book. And if people haven't gotten a copy of it, I'll just put it up again because it's such a beautiful, we can all show. It's gorgeous. And it's a
Thank you.
really accessible book with big ideas. But Ali, congratulations. You shared such important things in a very
you.
personal lens, through a very personal lens that's obviously just very deep and meaningful to you, and it
Thank you.
shows. It's
Yeah.
beautiful.
Where can people get your book or learn more about the narrowing?
Yeah, you can get The Narrowing anywhere books are sold. Whether you want to go to an indie bookshop or to purchase the book online, I would of course be delighted. And there is an ebook available, an audiobook available. So I hope you check it out.
I did enjoy the audiobook. It was nice. You're an
Thank you.
eloquent speaker, and it was great to hear you
Thank you.
reading the book to me.
Thank
That's
you.
so cool. Yeah, and you can find out about the Motherhood Center. I'm sure it was put in the chat. We're usually pretty good about that, but at themotherhoodcenter.com. Though you'll find it anyhow if you look up anything postpartum or perinatal related. And we're hoping to continue to expand. We've grown since you were here, Ali, years ago, and I know you're
Yes.
back. But like we started with just a few people, and now we're pretty big and growing.
Wonderful.
So yeah, intending to be in other states, New Jersey and Connecticut next, and hopefully everywhere. So
Doing the good work. All right.
everybody
Mhm.
here.
Yeah, thank you both for this conversation. I've really enjoyed it. And thank you to the audience for joining us and for the questions. And you can find the book, The Narrowing, wherever you buy books. And you can find the Motherhood Center. You can look at us online and certainly give us a call if you need some help or some support. Okay. Thank you, everyone.
Thank
Thank you.
you.